big question. Will breastfeeding make a difference in a child's health?
Oh, absolutely. I think there's unbelievable amounts of research out there about that. And I would just list some of the top conditions that we see in the healthcare community. Breastfeeding can help prevent cancer. So your child throughout childhood and actually life is going to have a lower risk of cancer. It will decrease the risk for childhood obesity as well as adult obesity, which in turn decreases, your risk for heart disease and diabetes, the top killers. It also decreases your child's risk of autoimmune conditions, including type 1 diabetes. So I know some parents who that runs in their family and are making the choice to breastfeed primarily even for that reason, to prevent type 1 diabetes in their family.
It didn't even used to be a choice. It went out of style in the 50s when I was a child, and mothers fed their babies with formula, and no one breastfed.
Yeah, I think there was a time when we thought science could outdo nature. And
I think so.
Yeah, and so we've since discovered, no, there are actually living cells even in breast milk, white blood cells, and active immunoglobulins, and things that protect your child's immune system and health. So, unbelievable.
I'm really glad that it's back in style. I did breastfeed both my sons, but I was treated as if I were just a little bit strange, really going against the norm. Can you imagine that?
Yeah.
So my kids were pretty healthy too.
Yeah, and absolutely that's what you'll see. Breastfed children are at decreased risk for serious illness and for chronic illnesses, even in infancy, especially in infancy, such as chronic ear infections, colds, flus, things like that. So it will actually save you money and worry in the long run to breastfeed.
And save your child's health.
Yeah, yeah.
Thank you
absolutely.
very much.
You're welcome.